America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Our producer, Mr. Darren Wilhite. I'm your host, Carrie Hall. This is your show, America. Thank you for joining us and making us one of the most listened to talk shows throughout the United States. You know, we've got over 200 affiliates around the country, so folks listen to us on AM and FM, but we now have 14 podcast platforms and YouTube, and it's growing every day. It's amazing to me how this thing has taken off. I think a couple broadcasts ago, I spoke to you about a group in Turkey that had downloaded one of our shows. When the gentleman who was the CEO of the company walked into their offices, they had the podcast up on their computer screen. So it's great that people are listening to us, not just here in the United States, I guess, but all over the world. We think that's wonderful. There are 14 podcast platforms: Spotify, SoundCloud, RSS, Overcast, Rumble, Apple, Pocket Cast, Pandora, TuneIn, Stitcher, Spreaker, Amazon, Google Podcasts, Odyssey Podcast, and also on YouTube. So you can download the show there if you want to tell somebody about it. This is one you're probably going to want to do that, especially if you have somebody in your family who is chronologically challenged, like me, okay, and you're interested in Medicare, because this is our annual Medicare open enrollment show. In studio with me, the good people from RPS Benefits by Design, Maria Allers and Carol Lee Steele. Welcome back for the 50th time, I think. Is that
Thank
about
you,
right?
Carrie.
Something like that?
We always love being here.
Yeah, you guys are old hands at this now, so it's really, you know, how quick it goes. So we're just going to dive right in, because the whole purpose of this is to educate you on Medicare. There's a lot of confusion around this. You see all these crazy commercials on television. There's, you know, you get a lot of stuff in the mail. I mean, it's amazing how we're bombarded with information on Medicare, and how much of it is misinformation, something that's not going to do you any good, or misrepresentation. And so that's why we do this show every year. So I'm going to start with Carol Lee, and just Carol Lee, let's just talk about, when does open enrollment start?
Open enrollment starts October 15th and it goes through December 7th. However, information can be obtained October 1st for the 2024 season.
That's a short window. Mm-hmm. I mean, you're not talking a lot of time here. You basically have got, 2 months, if that? Mm-hmm. Okay, a little short of 2 months, actually, in to make this decision. And what happens is people just get complacent.
They do. And each year it is so important to kind of review your Medicare health and drug coverage, just to make sure it still fits your needs, it fits your finances, and this is the time if you want to make a change.
I can't emphasize that enough, because I'm going to give you some specific examples of changes that have been made, some of them good, some of them not so good, that you're going to want to know about. And the reason that Carol Lee says you need that review is to see if, hey, you know, what you've got is great, everything's fine, they haven't changed the benefits, or, oh, by the way, do you know they've changed this particular benefit that's going to affect you, dollars out of your pocket, or access to care, or prescription drugs, or something else? So that's what we're going to do today. We're going to talk about that, and we're going to bring that information to you so you can make a decision. And by the way, if you're part of that sandwich generation, and it's your mom, your dad, your grandmother, your grandfather that you're taking care of, maybe you have power of attorney, maybe you're the one that helps make these decisions, you might want to make sure that, you know, they download this if you want to have them listen to the podcast so they understand what's going on. And it might be a little easier to convince them if you think they need to have a review and maybe make a change. So let's just start with original Medicare to Medicare Advantage, or original Medicare to Medicare Supplement. Let's just talk about that, because you hear this all the time. Well, I've got Medicare. I don't need to do anything else.
Oh, yes, you do.
And why is that,
A and B only covers about 80% of all services. So if you have a $100,000 medical occurrence, you're kind of on the hook for that $20,000, and there is no out-of-pocket on that, which is really a scary thing.
Okay, so let me translate that out to a little better for you so you really understand this. She's saying there's no cap. So cap. If it's 20% of 100,000, or if you had open heart surgery and it's 250,000, you get to pay 20% of that. And believe me, the hospitals will pursue you to get that 20%. Mm-hmm. They're not going to write it off. They've got a very robust collection policy at every one of these hospitals. I don't care where you are. If you're listening to me in Largo, Florida, one of our newest affiliates, you're out in San Bernardino, California, or you're here in the Midwest somewhere, these hospitals pursue this very seriously. So A and B, yes, they cover a lot, but there's 20%.
They cover a lot, but they cover. A covers hospitalization, skilled nursing, and hospice. B covers pretty much everything else, which would be your, doctor's visits and your outpatient, facility, durable medical equipment, echocardiograms. That's going to be your B service. And that's about 20% of, like you said, a heart surgery is quite a bit.
Yeah, it is, or a cancer, or whatever the case may be, and so that therein lies the issue. So now let's contrast that with, okay, I went out and got a Medicare Advantage plan. Now what's my exposure?
Now your exposure, and typically most of them are a zero premium, and they have a maximum out of pocket. So you are exposed to only what that maximum out of pocket is for any A and B Medicare covered service.
Yeah, and what's interesting, Maria, is every carrier out there, and Carolee just mentioned this, I don't care if it's United, Humana, Blue Cross, Cigna, who am I leaving out? Aetna. Mm-hmm. They've all got zero premium plans now.
Yep. That's right, they do.
And people sometimes go, well, how can that be? I always used to get the question of, what's the gimmick? What's the catch? There is no gimmick and there is no catch. There's zero premium because the carriers are getting reimbursed by Medicare, CMS, to manage your Part A and Part B. And by the way, they do a lot better job of it than Medicare does, okay? The level of fraud under Medicare Advantage plans is less than 1%. You don't even want to know what the number is under Medicare, okay? It's ridiculous. The amount of money every year that is misused, stolen, and otherwise misappropriated because the good folks at Medicare are handling it themselves. That doesn't happen on the Medicare Advantage and Medicare Supplement plans. So let's just talk about, break down a Medicare Advantage plan, the different pieces of it and what it covers on the Part B and the Part A and all the rest of it. Carolee?
Well, and the companies that do offer Medicare Advantage plans, they must follow rules set by Medicare.
So they just can't go out and create a plan.
Correct. They have to do that. However, what differs is the out-of-pocket maximum. Copays differ. All of their little supplemental benefits of dental, vision, hearing may differ a little bit. You may pay $20 for a specialist at this carrier, $35 on this carrier. Those things differ. However, in general, they have to follow some Medicare rules.
So basically, what we wind up happening is they have to follow certain Medicare rules. So there is an out-of-pocket max. Mm-hmm. So you can't wind up with more of a liability than whatever that dollar figure is. We can give some examples of that here in a minute.
Right.
And then there are copays. So the Medicare Advantage plans have copays for almost everything you do except preventative, right?
Preventative, all preventative, mammograms, your lab services for your annual
colonoscopies?
physical. Colonoscopies.
There you go.
As long as it's preventative, it's
I'm
covered.
just saying, okay? You can't use the excuse that it's going to cost money because it's free. It doesn't cost you anything, okay? Yeah. Mm-hmm. So all of those preventative services are covered at a zero copay, and there is no out-of-pocket form, right?
Correct.
Yeah. So when you contrast that, on the other side, if you just have the Part A and Part B, we're back to that 20% exposure. Mm-hmm. I don't care what you get done.
And the drug plan as well. So if you only have A and B, what are you going to do for the coverage for all of your medications?
Yeah. And that's the Part D prescription drug coverage, and that's inside of the Medicare Advantage plans.
A lot of the Medicare Advantage plans do have a drug coverage benefit. Mm-hmm. So you don't pay an additional premium for a standalone Part D drug plan.
Yeah. And there are plans that don't have the drug coverage in them, most specifically the plans that are for veterans. So Blue Cross and Blue Shield has one called the Valor Plan. Mm-hmm. What does Cigna?
The Honor plans, and then I've heard of other ones too. And typically those have great coverage for some of their, copays, coinsurance for their doctors, but they do not have meds. So it's a supplemental benefit to the VA. It does not replace it.
No, but here's the good news. If you want to go to a private physician and not go to the VA,
correct,
you've got access to anybody in that network. Okay, that's the real good news. Most of the reasons that we see for veterans not moving off VA is prescription drug coverage. What they've done is they've carved out prescription drug coverage, let the veterans keep their medications over VA, but you can get everything else just like anybody else on a Medicare Advantage plan.
Some people want to be able to go see a primary care physician around the corner instead of having to go to the VA facility, and that's at a zero cost. So
and some people might not want to wait 4 months, 5 months to get
and they want a second opinion.
Yeah, and as opposed to trying to get into the VA to get a surgery done or get a specific elective done, whatever the case may be. So there are options and alternatives, and the whole purpose in going through all of this with you and doing this today is you really do need to talk to somebody. You really do need to take the time to sit down with somebody that understands this stuff, because there are a lot of changes, and that's what we're going to talk about today. So we'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. If you want information, go to the website rpsbenefitsbydesigninc.com. That's inc.com. Stay tuned. We've got more right after the break.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producer, the always perfect Mr. Darren Wilhite. I'm your host, Kerry Hall. In studio with me, the good folks from RPS Benefits by Design, Maria Allers and Carol Lee Steele. And this is our annual open enrollment rollout of Medicare show, where we're talking all things Medicare, Medicare Advantage. Again, you know, I'll reiterate, you really do need to talk to somebody. Look, you've been on a plan for 2 years, maybe you've been on for 3 years, you think everything's great. Maybe it is, okay? And then maybe it's not. And we're going to point out some things to you today. There are changes being made every year on these plans. This year, there are some pretty significant changes out there. And if you don't know what to look for, you're not going to understand it until it hits your pocketbook, or until it hits your ability to see a doctor or get something done that you want done. By the way, what does it cost to use somebody like the folks at RPS Benefits by Design, who are CMS certified Medicare experts? Zero. You don't pay them anything. There's no cost to you. Okay, so there's no risk here, but there is a big reward as opposed to doing it the right way or doing it the wrong way, because the wrong way can cost you a lot of money. It may cost you access. So that's one of the reasons why I'm urging you to take the time to reach out to these folks. If you want to get a hold of them anywhere in the country, 877-385-2224, 877-385-2224, and the website, RPS Benefits by Design, Inc., INC.com. There's a landing page up there. Fill it out. They'll have somebody reach out to you. They'll be happy to help you. Didn't you tell me a story off air about a lady from New York calling you?
Well, she was actually a VA person. Okay. So we kind of looked at the Valor and the Honor ones where they don't have prescription drugs. She was so enamored by the fact that she was going to have $1,000 worth of either dental, vision, hearing. She wanted all of it for transportation because she didn't have anybody to take her to the doctor. So she wanted that VA plan that's going to supplement her other VA. She wanted the plan to supplement her VA plan. It's not going to replace it, but she wanted the transportation.
So explain that, though. So that's one of those things that's an additional benefit that the carriers bundle up. And this is really how they kind of compete with each other.
Correct.
They compete with each other on the out-of-pocket maxes and things like that. But where they really get in the weeds and compete with each other is on all these ancillary benefits that they add on. So who's got the best deals? And we'll talk about some of those in a minute. But that particular thing that you're talking about is an add-on benefit. Mm-hmm. And she had $1,000 worth of transportation. That's a lot of Ubers.
She used it all for transportation.
That's a lot of Ubers, folks.
Correct.
Yeah. And so that's a classic example of, if you don't know, that's why you ask these folks. That's why you do this. So there's somebody that had a need, had no idea that was going to be available. Carol Lee meets with her, goes through the whole thing. Oh, my God, I get to use $1,000. I don't have anybody to drive me to the doctor. I can't drive, whatever the case may be. Oh, you got $1,000 now on a debit card. Go do what you need to do. Mm-hmm. Those are the kinds of things you need to know. And the way you get that information is by dealing with somebody like the folks at RPS Benefits by Design. Anywhere in the country, they can help you. It doesn't matter where you are. They've got plans all over the country. They can tell you what makes sense and what doesn't make sense. Let's shift gears a minute, though, Maria. I want to talk about customer service because, it's a funny thing. I say, and I've had people say this to me, the word service is gone out of customer service. And it happens more often than not. You call a major company and you want help with something, you're getting a phone center in Guatemala, okay? And if you can understand what they're saying, you might be able to get something done, and maybe you won't, okay? Now, there are exceptions to that rule. I mean, there are certain companies like Blue Cross and Blue Shield of Kansas City, just won for the third time the J.D. Power Award. We use Spectrum Cable Service. I'm amazed. Those people answer the phone. When stuff breaks or something goes wrong, they actually do something. I mean, there are companies that do get it, but there are so many companies that don't, and a lot of these insurance carriers fall into that trough. And you see these celebrities on television: William Devane, J.J. Walker, Joe Namath. I think they put him out to pasture. Mike Huckabee pitching these Medicare plans. You're calling some call center somewhere. What happens when they have a claim issue or a provider issue and they're trying to figure out a prescription drug?
You got to take care of it yourself. I mean, those celebrities are great to look at on TV, but they're not there to help
Some
you.
of them, not all
yeah,
of them.
you're right. You're right.
Yeah.
But really, when you call these numbers, they don't know where to start. They don't know how to get the answers, or they'll just give you the information to call the 800 number and another. Press this 1 for this, 2 for this. When you call us, we help you with that claim. We advocate for you.
Yeah, so this is the point I want to make. Okay, I used to have a commercial that I ran called "You Can Either Call Us" at Benefits by Design, before Benefits by Design became part of RPS Benefits by Design. I said, you can either call us or you can call the 1-800 I don't give a damn number at the carrier. And what I meant by that was what Maria just talked about. So when you go to that call center that J.J. Walker, sent you, and you connected with somebody in wherever they may be that's going to sell you that policy that they want you to buy. Now, 3 months later, 4 months later, 5 months later, you've got a problem with the prescription drug. Maybe they're telling you it's not covered, or you don't understand the formulary, or you want to go to a specific hospital that may or may not be in the network. Try calling them and see what you get.
That's right. We also have what we call a customer service retention specialist, where she will follow up with you after you enroll to make sure that your coverage is exactly what you need, and to also check in to make sure that you don't have additional questions afterwards. So you have a direct line to her that you can call, not only just our customer service specialist, but also to Carolee and all of our other Medicare specialists that are certified.
So there's actually somebody there that's going to help you.
Yes, that's
Yeah,
right.
yeah, and that's important, and it's important to understand that they know the ins and outs of these Medicare policies. And like I said, in the next segment, we're going to talk about this, because there are a host of things that are going on out there that you may not be aware of that can impact you directly. But the disconnect, Maria, between these national call centers and the people that they have pitching this stuff. I mean, William Devane sells everything from coins to Medicare to, it's just remarkable to me. That man's a busy man. Yeah. Their knowledge about Medicare is zero, okay? They are strictly pitchmen for this stuff, and they're throwing you into some national call center that person's 99% probably not in your town or your city, okay? And you're going to be talking about hospitals, doctors, all these different things. And do you get good information? But the second piece to that is not if, when something goes wrong, when there's a claim issue, when there's a provider issue, when there's a prescription drug issue, how do you get that solved?
Yeah, so we've had clients where they're at a doctor's office and they say, I'm having my coverage, problems with my coverage. They call Carolee, and Carolee gets on the phone with the carriers, figures it out so they can continue to go with their appointment, attend their appointments. So that's the benefit of using us, is having someone to call when you have a problem. That's when you need to speak to someone, not just selling me the product, but being there to support me through the process.
And I piggyback on that, because a lot of these people they want to put down a sale. What we honestly do is we take care of the people. Regardless of what it is, we take care of the people. And in the end, I think that's what caused.
And to that point, if they call you and they're on a policy and you review the policy and there's alternatives out there, but the alternatives are no better than what they've got, you're not going to try to sell them something else.
Absolutely
You're
not.
going to tell them, stay put.
Yep.
And that's the difference, folks. That's a big difference. The phone number, 877-385-2224. You want an evaluation. You want to look at what you got. Maybe that's your mom, your dad, your grandfather, whatever. Or the website, rpsbenefitsbydesigninc.com, rpsbenefitsbydesigninc.com. Once again, the phone number, 877-385-2224. They're happy to talk to you. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIE Radio Network. You can find out more about us by going to our website, americashealthcareadvocate.com. Look, if you've got a question or comment or anything, send an email to us. I get people sending me emails all the time. They need help with something. We're happy to help you. Okay, it doesn't matter where you are or what the issue is. If I can help you, I'm more than happy to do it. Go to the website, americashealthcareadvocate.com. By the way, all the shows are on those 14 podcast platforms I named in the beginning of the show. I mean, if there's a platform out there we're not on, somebody needs to tell me. Okay, and the shows are all posted on YouTube. So the videos are up there, the audio's up there, and obviously if you're in one of the areas where we have one of our 200 radio station affiliates, you can certainly listen to us on AM, FM radio. All right, so now let's go back to this, Carol Lee, and let's. I want to do some specifics here. What I'm trying to do here is illustrate to you what you don't know. Okay, and how what you don't know can hurt you. Mm-hmm. So let's just start with one carrier that made a change to their formulary, explain what a formulary is, and then what they did.
Well,
that's for this year. We're not naming the carrier because we can't do that just yet, but we want you to see what we're talking about.
So in 2024, they've come out with a plan that has a very significant low maximum out-of-pocket, so what you're exposed to. However, digging in a little deeper, they have raised one of their tier 3 copays. Now, tiers are where your drug lies on a formulary. So you have a copay.
Humira.
Yeah, Humira or Trulicity, Eliquis.
Let's just use Humira. So prescription Humira is $4,700 a month. So now what did they do? Tell me. Now I've got Humira. I'm on this plan, tier 3. I didn't know they'd changed the formulary because I didn't ask anybody. I'm on that, or United or whatever it is, and I just renewed because that's what I'm already on.
Right.
I didn't bother to get it reviewed, but I went to get my Humira, and what happens?
Well, some of their tier 3 has now gone to a 20% copay. So if you copay a $4,700 retail pharmacy, that is quite a lot of money.
So now you just wound up being that's $800 for that prescription that you get to pay plus $800 plus. Okay, that's what I'm trying to explain here. If you don't know what you don't know, okay, and these folks do because that's all they do. All right, and that's the kind of thing that could be a huge mistake. If you're taking that Humira because you've got whatever, maybe you've got colitis, maybe, who knows? Maybe it's an arthritis situation, whatever it may be. But you're taking Humira because it works, and the plan you're on now covers it, and you have a copay. Okay, that's great. Okay, but they just changed tier 3. So what was the other thing that she said that was interesting there? They lowered their out-of-pocket max, so they look like they've got better benefits. But if you get in the weeds, you may not be in that situation. It may be a totally different situation. Now, you don't have a tier 3 drug, and for you that might make sense. Okay. Of course, the question I always ask myself is, what happens if I wind up having to have one?
You have to have one, correct.
Yeah.
And every year, all of the carriers that have Medicare Advantage plans will send out an annual notice of change to each person, but not everybody goes through it with a fine-tooth comb. And that's where we come in.
Yeah, I would say about 90% of the people it winds up in the circular file.
So they know, oh, wow, the out-of-pocket's the same. The specialist has only raised $5. But you really need to take a deeper dive. That's why we're here, is to be able to review what they have. Does it fit their needs? Does it, fit what they need? Yeah.
And so now let's reverse that scenario and let's say, well, where can I get a better benefit that I have now? So one of the major carriers out there here in the Kansas City Metro, okay, is now offering a debit card with $2,000. Is it $2,000?
$2,500.
$2,500 debit card. I'm going to repeat that, a $2,500 debit card. You can take that debit card and you can use it for anything you need to use it for. You can use it for dental, you can use it for vision, hearing aids, over-the-counter medications, whatever the case may be. That's a $2,500 debit card. That's part of the plan. Nobody else has that particular benefit on the other carriers right now. That's something brand new that they're offering. And you can pay another $25 a month for an additional $2,000 for dental.
Correct. And that $2,500, somebody may have a huge, like, they need dental work that year. They're going to use all the $2,500 for dental if they want to. Or if they can split it up, like I need frames and lenses and I need a little bit of dental and I can use some for over the counter. That's what's nice about that flexible benefit, is because you can use it how you need it.
Yeah. So let's take that scenario just a second. So you're going to have major dental work this year. Here's a plan that's got $2,500 debit card you can use. And if you pay another $25 a month, they add another $2,000. Now you can go to the dentist. You have $4,500 to spend. That's a little bit different, okay? You have $4,500 to spend. You go to an in-network dentist. So essentially, you wind up with $6,500. I'm just doing this top of my head, but you wind up about $6,500 worth of benefit because you get the network discount and you got $4,500 on a debit card you get to use. That's pretty strong.
It is very strong. It's a large.
If you're that person that knows you're going to need, maybe you need dentures, maybe you need a crown, maybe you need a bridge, it can be paid for. You don't have to pay for it, but you're not going to know that. Okay, if you don't sit down with somebody and talk to them. Maybe you're on a plan with another carrier and you're not going to get this information. You're not going to get it because they're not sending you a plan notice of change because you're not on their plan. But if you were to call RPS Benefits by Design at 877-385-2224, you would know that, because Carol Lee Steele or Joyce Thompson or one of the other folks over there is going to take the time to go through this and explain it to you and say, there is a better benefit over here you might want to take a look at. Okay, so let's talk a little bit more about, there were changes that we can see coming this year. Do we see drastic changes in the plans, or are they pretty much stabilized?
They've pretty much stabilized. I think all of them still have a zero premium. Most of them have gotten rid of their deductibles for any of their medical services, which is good. The out-of-pocket maximums really haven't changed a lot.
Yeah, so let's talk about that, because, I remember back in the day when I was doing this, and that wasn't that long ago, but it was long enough, people would look at that out-of-pocket maximum and go, oh, my God, it's $4,500 or $3,500, whatever it is. It's not a deductible.
No.
The problem is that's what people equate it to.
Absolutely.
Well, I'm going to have to spend $3,500 or $4,500 or $3,100 before they'll cover anything. Will you explain that how that works?
Well, the out-of-pocket maximum is what you're going to be exposed to if you used everything. But most people, they will go to a primary care physician, $0. They'll go to a specialist, $30. They'll go to and have some lab work done or an X-ray, $10. Tip for the X-ray. So they kind of accumulate, and it's copays and coinsurance. When you hit that maximum out of pocket, then any A and B Medicare covered service, the carrier will pay for past that.
So the largest expense you typically incur is inpatient hospital. And I don't know what the number is now, but it used to be like $250 a day you're responsible for the first 5 days. Mm-hmm. So there it is. Okay, so now you're looking at $1,250 if you're hospitalized and you got a hospital bill of $70,000 or $80,000. So when people get hung up on that, I would always go back to them and say, the chances of you ever hitting this are pretty slim.
Well, a lot of people are used to their employer coverage where they have a large deductible. And so they know that they've got to meet that. If they go into surgery, they've got to meet that, and then a coinsurance, and then the out-of-pocket. That's not how this works.
So, Maria, if they're on a plan and they're kind of lost, they're like, I don't know. I signed up for the plan. It's a good plan. I'm happy with it. They're halfway through the year and they call. How do I find out how do I find out how much money I've spent and what I have left and what's my responsibility going to be? They can call.
They can call us and we'll reach out to the carrier and get the information for them. Again, you're speaking to a live person, and I think that's the key. I don't know about you, Carrie, but my parents, they don't like the automation. They grew up in an era where you just pick up the phone and you talk to someone and ask a question. It doesn't matter what documentation you have. I want to speak to someone. I want to have that conversation. I want to understand what I need to do to get this covered or how much it's going to cost me.
And that's funny because we can talk about almost anything across the spectrum in terms of services. But when you call a large company, typically what you get is there's at least 5 voice prompts. Mm-hmm. I recently had a problem with a bank. okay, where they had done some reporting to our credit bureau, which is 100% wrong. They'd actually cashed the checks and said they didn't get paid. And I'm like, I got the checks right here. You did get paid. But in order to get to a customer service person, I had to go through at least 6 voice prompts. And then I got the wrong customer service person, but at least it was somebody that answered the phone. And then they connected me to the customer service person in that department, who, by the way, turned out to be very nice and did a wonderful job and got it taken care of. But my God, it took me 20 minutes to get to the person I needed to talk to.
Yeah, and time is precious. And we know people are impatient because they have a need, they have an issue, and they want it resolved.
Yeah, they want it resolved, and they want somebody that's there to help them. And that's the point. At RPS Benefits by Design, they're your advocate. They work for you. They don't work for the insurance company. They work for you. So if you want help, they're there to help you. If you want an evaluation, and I urge you to do this, really, take a few minutes, pick up the phone and call them, or go to the website, fill out the landing page. The website is rpsbenefitsbydesigninc.com. The phone number, 877-385-2224, 877-385-2224. Speak to the lovely Carol Lee Steele or Joyce Thompson or one of the other great people over there. They're happy to walk you through and tell you what you're doing makes sense or it doesn't make sense. Stay tuned. We'll be right back after the break here on America's Healthcare Advocate. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast here on the HIA Radio Network. In studio with me, Carol Lee Steele and Maria Allers from RPS Benefits by Design. If you want some help, maybe you want to talk about your mom's plan or your grandmother's plan, call them, 877-385-2224. It doesn't cost you anything to talk to these folks, okay? They can help you. They're happy to help you. 877-385-2224. Anywhere in the country. It doesn't matter where you are. They can take care of you. They're happy to help you with whatever you need. The website is rpsbenefitsbydesigninc.com, rpsbenefitsbydesigninc.com. We're going to switch gears now and talk about Medicare Supplement. I'm on a Medicare Supplement plan. I've been on it since we turned 65 with Blue Cross and Blue Shield of Kansas City. It's a great plan. I wouldn't trade it for anything. But you pay a monthly premium.
Correct.
It ain't no zero premium, okay? Mm-hmm. So a lot of folks are having these plans go up in cost year over year over year. Talk about that, and then the question is, well, can they move off of that over to a Medicare Advantage plan, or are they going to have to go through an underwriting process where they can be declined?
That's a great point. We have some people who, they may pay $300 right now for their Medicare supplement, and it's really kind of tough financially. And so I always say, that 300 times 12, because they pay it monthly, is $3,600. When that amount kind of equals some of the out-of-pocket maximum, that's when you need to take a deeper dive into whether or not you need to look into some of that. I have people that will go on to Medicare Advantage. They said, well, what if I have leukemia and there is no underwriting, no medical underwriting, so they will not look at your medical history to go from a Medicare supplement to a Medicare Advantage plan during the annual election period.
So that's the whole point, okay? And if you can go from a $300 a month to a zero premium, maybe that's something that makes sense for you. I'm not going to tell you it does or it doesn't. What I'm going to tell you is that's why you pick up the phone and call these folks, so they can explain. Also, if let's say you've got an RV motorhome and you travel and you don't want to go on a plan that has limited benefits outside of where you happen to live. Well, talk about that, because now some of the plans, like the Blue Cross Blue Shield plans, have national networks where that's no longer an issue. That used to be a big issue, Medicare Advantage versus Medicare Supplement. Now it's not. Medicare Supplement basically is you can go to any doctor, any hospital in the country, as long as they take Medicare. Correct. But now, under some of these plans, like the Blue Cross and Blue Shield plan here in Kansas City, they've got network coverage around the country, right?
Correct. And a lot of them have on the PPO, it just keeps getting more broad and more broad. Like, for instance, Blue Cross and Blue Shield of Kansas City on their PPO network, they have the Blue Cross PPO network sharing. So there's only like 2 states. But if you can go to Colorado, if you have a sinus infection and you're like, I don't want to go all the way back to go to the emergency room, they can go to a PPO network, Blue Cross doctor in Colorado for a zero premium, like if they were in Kansas City.
And that's a big deal, okay, because that was a big stumbling block before.
Very big.
Again, if you're on a Medicare supplement and Carol Lee said if it's starting to bite, okay, because these premiums go up every year, it's worth taking a look and seeing what's available out there that is not part of the Medicare supplement.
And on the Medicare Advantage plans, any emergency or urgent care service will always be considered as in network, and that's worldwide. So that's really mainly what we do. I mean, if we go to Colorado or we're going to go skiing, we're going to go to the emergency room if we break our leg. So any emergency urgent care service will be considered as an in-network service. So that's very important to know.
And the same thing applies, right, Maria? If they're on a Medicare supplement and they call on customer service issues,
Yep.
you're right there to help them.
We are. We can help them find the closest emergency room or urgent care facility. We are right there for them. And again, they get directly to a live person.
And that's, again, I can't say it enough times. You know how frustrating it is when you call someplace and you have to go through all those voice prompts and try to get some help with what you're trying to do. It can be very, very difficult. So we're coming to the end of the show. What else? What are you missing, Carolee, that we need to talk about that we've not talked about?
My thing is there is not a one-size-fits-all at all. And so being able to sit and go over their medical needs, their financial needs, and a lot of it is, what is their comfort level as far as risk and things like that. So we'll go over. Each person has their own individual needs, and that is what is so important for them to come to us so that we can kind of evaluate that and put them where they are the best served.
And so there's a combination of things there. If you listen carefully to what she said, it's not just your medical needs, it's also your financial needs. How does this play? A lot of seniors are on fixed incomes, okay, and so these things are critically important to them. Can I afford this coverage? Am I better off making that move off that Medicare supplement over to Medicare Advantage? What are going to be the differences? And the other thing is, like we talked about, there are a lot of changes on these plans that happen year to year. Mm-hmm. And if you don't know about them and you go ahead and you sign up for something that you haven't had a chance to go through and understand, 6 months later, you might find out that's a problem.
Mm-hmm. Absolutely. And to kind of do a little bit of a pivot, I think it's really important. All of these people turning 65, so they think, oh gosh, I got to get on to Medicare. I've got to get on.
Sponsored healthcare versus Medicare.
Correct. And so everybody's I've got to get on. I'll have a penalty, et cetera. About a third of all people are working past the age of 65. So it's like, can I stay on my employer plan? Do I have to move off? Well, it's critical to know all of the little pieces and nuances involved in that. If you have a company that has 20 or less employees, do you have a company that's, over 20? It's different for each one of who pays first, Medicare, the employer. And it's so important to sit down with a Medicare specialist and go over all of those particular.
Because depending on what your employer pays, you may be better off moving to a Medicare
Correct.
Advantage plan.
Absolutely.
If you're paying 50% of that premium and you're 65, that's probably a pretty good sized chunk of change. Mm-hmm. On the other hand, if the employer is covering all of it, then it's probably not something you need to think about. But there are reasons for that, and maybe your spouse needs to get off the plan. So that's all part of what you do.
Absolutely.
And to piggyback off of Carolee, if you have a group plan with us, we have our account managers work with our Medicare specialists. So now we have visibility to your group plan and visibility to the options on Medicare to help you determine what is the best option for you.
Yeah, and that, again, it's all about service, people. I mean, the only difference between RPS Benefits by Design and another 10 insurance groups out there that do this, consulting groups, brokers, is customer service. Everybody offers the same products. The products are the products, okay? But it's about customer service. It's about taking the time to understand people's needs and not jamming things through to jump to the next deal. That's not the way they do it at RPS Benefits by Design. Hasn't been since I had the company when it was Benefits by Design. Isn't now. They do a great job, and they care about the people that they service. If you want help, 877-385-2224, 877-385-2224. The website, rpsbenefitsbydesigninc.com. Thank you both.
Thank you, Carrie.
We'll do this again before it's over with. For open enrollment's over, but this gets us out of the gate and off the ground. And now I'll leave you with this thought from Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, that's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.